can I once again ask you to lead us through the introductions?
Sure. So the usual disclaimers, I'll probably mispronounce some people's names. I apologize in advance. Just call me out if I do. And throughout the meeting, just keep yourself muted if you're not talking, so there's no like audio chaos. So I'm Andrew Harris, I co-chair the Manhattan DD Council Transition Committee with David Summers. Kathy, you want to introduce yourself?
Sure. I always forget that before I hand it off. I'm Kathy Kelly from AHRC New York City and chair of this Manhattan DD Council.
Carol Lincoln.
Carol Lincoln, did you say? This is Carol Lincoln. I am from Adapt Community Network. I'm the provider co-chair of the DD Council, and I am the co-chair of the Family and Provider Information Committee. I just had to write it down, but I didn't. Morning, everybody.
Sorry, the other thing I always forget to say is if you're from a provider agency, you have an announcement. Feel free to do that along with your introductions. Ellie Rufer.
Hi, Ellie Rufer, parent co-chair of this council, co-founder NYC Fair, and parent advocate. Lots to do, lots to talk about.
Dejal Choi Cork.
Hi everyone. Good morning. This is Dejal from GHO. We have just openings in our waiver programs, employment, and they have without welcome and weekend respite. And we have also times for family support service coordination, and we do the Queens resident free evaluation, family reimbursement, case management, and we have a lot of funds for family reimbursement for Manhattan families. Programs are run in person and virtually also still. And then we have a contract with the Care Design New York. We're helping individuals with the DD or IDD and their families whose English skills not sufficient. So we can help with them their enrollment. My phone number 718-307-6570, tquark@ghoinc.org. Thank you.
Thanks. Margaret Puddington.
Yes, I'm a parent advocate. Kathy, is anybody taking minutes? Because it's a Jewish holiday, Lana is probably not on.
Yes, I'm doing minutes as we speak, as well as it is being recorded. So
Oh, wonderful.
we're good.
Good morning, Margaret.
Thank you.
Morning.
How you doing? This is Stephen.
Hi, Stephen. Oh, hi, Stephen. How are you?
Hey, Ellie. How you doing?
I'm good. How are you, Stephen? Good
All
to
right. You're doing the Central Park Challenge virtually this year, right?
Yes, sir. Absolutely.
Oh, yeah, the Katie Club.
Yep. Katie's fan club.
And hey, Stephen, I was actually about to call on you next if you want to introduce yourself.
Yeah, my name is Stephen Holden. I'm a self-advocate, and yeah, I just got the link and everything in the email and everything. So I just wanted to sit in and join in on, because this is right in my alley and everything. Because I know we're in trying times, and I just wanted to see what this is about and everything.
Good.
Absolutely. Welcome, Stephen, and thanks for joining.
Yeah.
Thanks for joining us.
He's a parent. So this is the parent.
It's a mixed group. It's all different people from this community.
Oh yeah. The council, right?
Mm-hmm.
Yes, it is.
Oh yeah. Your son still goes to Program Market, right?
Well, Stephen, one of the things that we do is we provide a lot of information here, but we don't talk about individual people.
Right.
Okay?
Exactly.
Okay, Stephen, I'm going to put you on mute so that we can continue with other people
problem.
introduce themselves. You got it.
All right, welcome. Next up, phone number ending in 5051.
Hi, good morning. It's Stuart Flom.
Morning, Stuart. Next up, Alice Schulman.
Hi, I'm a parent of an adult daughter.
Welcome. Next, Crystal Dawn.
Hi, I'm Crystal Dawn King from IATS, IAC of New York City.
Welcome. David Summers.
Good morning, everyone. I'm David Summers, AHRC New York City. I also co-chair the transition committee with Andrew. In AHRC, we are accepting new applicants for day habilitation, which is currently being offered virtually and in person. I'll put my contact information in the chat if anybody is interested.
Emily Gable.
Hi, I'm Emily from YAI. I'll post our vacancies in the chat, but just real quick, we have openings in family reimbursement, free evaluations for people without Medicaid, Community Hub, and then on June 12th, we have our Latina conference, which is virtual, and that's a all-day event fully in Spanish.
Thanks. Gavin Myers.
Hi, here from the New York City Department of Health and Mental Hygiene. Thanks.
Thanks for coming. James Doherty.
Hi, I'm James Doherty. I'm one of the deputy directors at the OPWDD New York City Regional Office.
Thanks for coming. Next up, Jay Kleinman.
Yeah, hi, good morning, Jay Kleinman from LifeSpire. We have behavior management in Manhattan. We also have that in Queens, in fact. So if you have someone that you'd like to refer who's having behavioral issues at home, just shoot me an email. It's the letter J, Kleinman @lifespire.org, and I will spell that out in the chat. Thanks.
Thanks. Jesse? We can come back. Jim's iPhone.
Jim Malley from Esperanza, and together work on the legislative committee.
Thanks. Kimberly McCoy.
Hi, I'm Kimberly McCoy. I'm a senior family educator from Include NYC, and I'm also a parent of a child who receives OPWDD. I'm happy to be here.
Happy to have you. Karen Liebman.
Hi, yes, Karen from Adapt Community Network. I see that Wendy De Leon has already put all of our openings and information in the chat.
Great. Lily.
Liliet Lopez, Night Connects, and I put all of our information in the chat.
Thanks. Mary and Jackie.
That would be me. I'm Mary McGuire Reefer. I am a parent of a 26-year-old boy named Nicholas, and he's in an adult day program. I'm also a co-chair of the Manhattan Family Support Service Advisory Council with Jackie Goldberg, who couldn't make it today. Just happy to see everybody.
Michelle Eaton.
Hi, everyone. Michelle Eaton from Advocates for Children, Senior Education Specialist. We provide various educational services from 0 to 21, and happy to be here.
Yep, happy to have you. Nicole, is it Pagano?
My apologies, I was on mute. Yes, Nicole Pagano, Adapt Community Network, Director of Family Support Services. Thank you.
Thank
Good morning.
you. Pat Lu Cheng.
Good morning, everyone. Pat Liu from GHO. I'm Family Support Coordinator, and we do have immediate openings for our job training program, especially pre-vote. It's getting ready for a June, started after the school. And also, Day Help Without Wall. Again, our agency can provide
assistance to the family who speak Chinese, Korean. We do sign languages also. Thank you very much. And my phone number is 718-307-6563. Thank you.
Thanks. Shanice Wilson.
Good morning, Shanice Wilson, FI Coordinator at Person-Centered Care Services.
And Wanda Acosta, did I call on you earlier? And anyone that I missed?
Good morning. It's Wendy DeLeon. I'm the Director of the Housing Assistance Services Program at ADAPT Community Network. Also, I put all the program openings on our chat, but just wanted to mention specifically, we do have funds in all 5 boroughs for family reimbursement. So please be sure to tell all the families, get the application and the receipts in as soon as possible. In addition to that, we have job openings for a community habilitation program. If you have any questions about that, please be sure to contact our Project Connect line. The number and email is on the chat. Also, Nicole Pagano can answer more questions about community habilitation. I know that you heard from her earlier. Lastly, I want to mention Home Community and Renewal, which is a New York State department, has opened their Section 8 waitlist. The last time this happened was in 2005. I put the link for that on the chat. Please spread the word. This is a wait list for you to enter a lottery so that you may be considered for Section 8. Please tell the people supported, their families, and even your staff. Thank you.
Good morning, everyone. This is Wanda. I'm sorry, I was having trouble unmuting myself. This is Wanda Costa from the New York Foundling. And we have openings in residential and day services, such as Day Have Without Walls, and on-site they have programs as well, community have, and supportive employment services. For more information, I put my number in the chat. Please contact me. Thank you, everyone.
Looks like that was everybody.
No, just one more.
Oh, sorry.
One more. My name is Sandy Naper with ADAPT Community Network. I work with the Family Connect team, and we've got some exciting workshops coming up really soon. On 3rd, she'll be talking about the role of the developmental pediatrician. And on Wednesday, May 26th at 10 a.m., we're going to have Lindsay Beal. She's a noted pediatric occupational therapist and author, and she will be talking about motor skills. And if you'd like to come to our webinar, you can call us at 718-436-7979. Extensions at ADAPT Community Network. Thank you.
Thank you. So again, welcome everybody. I think we'll move on to state news. James?
Sorry, but I'm trying to get myself unmuted. Good morning, everybody. So let me just flip over to notes. So I have a number of updates today. I'm going to start out with giving some updates on the budget. Then we're going to talk briefly about the upcoming new initiatives, as well as some very brief coronavirus updates and the HCBS waiver proposed amendments. So, the budget was enacted on April 7th, and I'm sorry, the budget was enacted. My notes say 2012, but it's certainly 2021. The things that were included in the budget were was $27 million for cost of living
Because that's not
adjustment.
going to be the last time she hears something like that either, you know?
Okay. There was also $23 million for to help avoid across the board cuts. There was an additional $10 million that was included to avoid the 1% reduction in Medicaid rates for rate rationalized programs. There was another $12 million to eliminate the need for to reduce spending for state-funded activities such as ISS by 5%. There was funding for CCOs to restoring CCO rate cuts. There was also funding for maintaining IBR. IBR is based on Staten Island. There was some discussion about merging it with the Psychiatric Institute, but the funding came through to help maintain it in its current form. There was also a number of different special funding initiatives identified by the state legislature. There was also, as previously discussed, there was additional funding to support the wide range of services funded through OPWDD. There was funding for the minimum wage increase, additional funding for increasing affordable housing options. There's also an initiative that some of you may have heard of called the FLOW Initiative, which I'll speak about later, but there was specific funding there as well. And there was also some funding for telehealth expansion. Okay, so that's the budget. In terms of the vaccine, I know that there was some CDC guidance that came out recently regarding when we need to wear masks. As of, I believe this week, there hasn't been any updates of the DOH or OPWDD guidance, but I do know that there are discussions about, what updates would make sense for the individuals and the staff in our programs. There is the visitation guidance still for residential programs still stands. Their visitation is permitted when there has been no new COVID case within the home in the last 14 days, and the facility is not currently conducting outbreak testing. And so there's the memo that went out on March 15th, 2021, is the most current memo. You see the HCBS waiver update. So CMS did approve OPWDD's application for the extension of Appendix K. And the approval means that the flexibilities will last as long as 6 months after the official end of the public health emergency. Appendix K, I think we've spoken about it numerous times, but it does establish flexibility for providers to bill for day hab and pre-voc services for when there's mandatory program closure due to a spike in COVID-19. There's also flexibility for retroactive billing, which has already taken place. And the extension, was set to sunset on October 14th, 2020, but it was, has been extended. The provision also allows providers to bill for a full unit of service for delivering at least 2 hours of service and a half unit delivered at least 1 hour, delivering at least 1 hour of service. So, so it does give providers additional flexibility in terms of how they bill. I will put a link to a webinar that occurred on March 12th, 2021 in the chat in case anyone wants to learn more about Appendix K. The agency has also submitted an application for a waiver amendment that would affect the quote permanent waiver. So the amendment will provide for ongoing authority to use telehealth for the service delivery for such services as Day-Hab, Prevoke, Respite, Pathways to Employment, Support Brokerage, ComHab, and SEMP. So the amendment that we submitted has requested that be made permanent, the telehealth for those services. It will also allow service providers to continue to provide ComHab services to residents of their group home in the group home setting if those individuals choose to receive the service and it's clinically indicated. So that's some additional flexibility that we're looking to make permanent. It also establishes CSIDD, which is the OPWDD's crisis services for individuals with IDD. It was formerly known as New York START. So in New York City, I think everyone knows YAI is the agency that provides New York START services and CSIDD services in Manhattan. SUS is the agency that provides it in Staten Island and Brooklyn. Okay, and I guess the waiver amendment would also include such things as residential reimbursement based on acuity levels. So matching the level of reimbursement to the needs of the individual, and it would be using the CAS assessment as a part of that. That is still under development. The FLOW initiative that I mentioned before is an initiative that OPWDD is partnering with voluntary provider agencies and CCOs to explore the option of individuals being served in voluntary programs who are currently in state-operated residences. It is a program that is completely based on individuals' choice and person-centered. So, there are some individuals in state-operated programs who may wish to move into a voluntary agency's residential program who's currently being served in one of their Day-Hab programs. And then, if there's vacancies that would be created through this movement, the state would be looking to help individuals who have aged out of their residential schools move back to New York State in one of these specialized state operations programs. The last update I'll have is on the 507 plan. So the 507 plan is a plan that I believe all state agencies developed this plan, and it's a strategic plan for the agency over a 5-year period. There is a mental hygiene law, section 507, that's where the 507 comes from, that mandates that agencies develop this plan. We will be seeking stakeholder input in a number of different ways. Families and individuals and stakeholders have an option of attending a regional forum. Region 4's happens to be on June 8th at 6:30. I will put information in the chat about this. If you have input you'd like to give by email, the email address is planning@opwdd.ny.gov. I will put that in the chat as well. If you're a family member or individual, or even stakeholder that wish to speak at the public forum, there is a process to request to speak. We will be limiting those speakers and prioritizing those to individuals and families specifically, and we'll want to make sure that everyone that has requested to speak is able to do that time permitting. So I believe that we have, we have a person in the regional office that's managing those requests. We will get to as many as we can, but we will have to cap the total number of people based on the time allotment. But again, you can also give your feedback in writing or in writing by mail or to the email address. The 507 plans, the general goal is that it will be pursuing improvements in the service system to ensure sustainability, equity, and accessibility of services. And it will, our final draft, I believe, is due to the legislature on November 1st, 2021. There is, we have noted that service providers have requested several continuing regulatory flexibilities, and OPWD is examining the ability to act on them. Some of the feedback that we've gotten is, or requests we've gotten is to consider improvements to the care management function and training, revising community placement procedures, including the MOLST contact access, and streamlining training requirements for medication administration and SCIP-R. So those are some of the requests that we've had to include in the 507 plan. So I know I just covered a lot of different things. Does anyone have any questions that they want to ask?
Just also on relating to the 507 plan, I have been contacted by Greg Roberts at OPWDD, and we're also going to try to set up an additional session specifically for Manhattan DD Council, or in conjunction with one or two other councils. So we'll keep you updated on that, but as of now, I do not have a date. So, just keep that in mind, and we'll keep everybody updated as we get more info on additional sessions.
This is Ellie. Yeah, Greg also reached out to all the family groups that he knows about and similar meetings. So they believe that there's going to be ample opportunity to have our opinions heard. There's some question by some of us as to whether if we don't show up at the forums or we're not heard at the forums, whether how wide that will go. And that's, I guess, a level of a leap of faith, because your forums will be recorded and the meetings anyway. So I think they're trying. My question is, after you listen to us and you gather whatever you think is appropriate, will there then be another opportunity to comment on the proposal that you are going to send to the legislature?
Yeah.
Yeah, Ellie, that's a good question that I don't know the immediate answer to, but I can certainly look into that.
That would be great. Thank you.
Yep.
Okay, as long as no other questions for James, we'll move on to Gavin and New York City DOHMH updates.
No, FMAP.
Oh.
Have you this is to James. The parameters came out from CMS. They're difficult to read and they're hard to interpret. Do you have any information on how how far you've all gotten, and where New York State stands on that, especially concerning the residential cuts? The legitimacy of the question.
Ellie, you're good at zeroing in on those important questions. you know, I know that that did come out recently, and you know, I'm hoping that we're going to put together some type of summary document, but you know, that's another thing I'm gonna have to follow up on. Just, you know, it's a very reasonable question. And I think you participate in the central office biweekly meetings, so, you know, we may get an update there.
Yeah. Yeah, it's just really hard for us to read. We need it. What do you call it? An executive summary, or what is that called? Yeah.
Right. Yep, it's on my list.
Thank you.
Anybody else for state update questions? Then Gavin, New York City update?
Hi, everyone. Good morning. I don't have too many updates. James covered a lot of them, but I do want to provide an update on a couple of things. The local services plan, which is our annual public health needs assessment with the state Department of Health. We're currently kind of finishing and winding that down. It's under review by our executive deputy commissioner, and that will be submitted to the state by June. For those who don't know, this year's survey covered COVID-19 and sort of how service providers, families, and others have been affected by COVID. And that's a shift from the past, but this year and last year, that was how the state wanted us to submit the local services plan. So once we have more updates on that, I'll definitely provide those at the next meeting. In addition, I wanted to provide an update on another study that we're doing internally at the health department. It's basically a study of the IDD community, focusing on better understanding service utilization, unmet need, and satisfaction, including the impact of COVID-19. And this is a study we've been working on for a while, but it's in conjunction with the New York Academy of Medicine. And that study, currently we've conducted about 11 caregiver interviews, a focus group, and some meetings with providers as well. And so that, once we have additional updates on that, more information about sort of the results of that, we'll definitely share that as well. And then the third point I wanted to cover today just is in relation to COVID-19 as well as the vaccine. So as you know, our current focus is really on vaccine operations, and we're trying to prepare the city for a complete reopening. We've seen COVID numbers decline dramatically in New York, including those who are ill, hospitalized, and dying due to COVID-19. And we continue to promote the vaccine to all New Yorkers. For all those who don't know yet, the vaccine is currently available for anyone age 12 and older. However, if you are in the 12 to 17 age group, you will need to receive the Pfizer vaccine. The Moderna and Johnson & Johnson are not currently approved for that age group. The city health department has a number of vaccine pods. And currently, in the past, it was basically you needed to make an appointment to go to those. But many of these pods, almost all I think at this point, are walk-in as well. So if you do need the vaccine and you haven't gotten it, definitely check out our city health department pods. Many of them throughout the city are walk-in, which is great. And so I highly encourage anyone to get the vaccine if you haven't. I will also include in the chat some additional links to our webpage so you can find where to get the vaccine specifically, as well as where you can get a walk-in vaccine. And I think those are my main COVID updates right now. So if anyone has any questions.
Thank you, Gavin. And you know, I did on behalf of Manhattan DD Council participate in both the local service plan as well as the focus group on the study of IDD and the unmet needs being done in conjunction with New York Academy of Medicine. So looking forward to the results of that and the summary of some of the findings. Winnie Schiff, IAC.
Hey, everybody. I actually thought that I'd begin with that CMS guidance, and because I joined late, I just want to ask first, how much did you go into that? Was it just what I heard? Okay, so I can tell you something about it, and to begin with, I'll say that on the surface, it looks really, really good. We think that there's a lot for us in there. The money can be, well, first of all, let me tell you that it will bring in $740 million to the state for OPWDD services, and 85% of that or so should be attributed to our services, the not-for-profit voluntary sector, which puts us out $629 million. So this is really, really, really good. We earn that over the course of the year, but we have until March 30th, 2024 to spend it, which is also really good. OPWDD needs to submit their plan within 30 days, but we were on a call with CMS yesterday, and it did sound like as long as there's sort of a good skeleton of a plan, that some of the details can be filled in later. So they don't have to know exactly how much they want to spend on exactly what, but of course the parameters have to be there. And I don't know how flexible they'll be about what they'll accept for the 30 days, but it sounds like you don't have to know everything about how all that money will be spent. That said, we can spend the money on DSP compensation. We can actually give raises to people, even though in theory it's a one-shot pot of money. We also don't know if it will be extended again. There's absolutely talk on the federal level about continuing it past the 1 year, but all of that is unknown to us now. So what we do know is that we have 1 year's worth, which is that figure I gave you. We can use it for hazard pay. We can use it to buy new PPEs for the next pandemic. I'm just gonna, and included in the guidance was another 3 30-day expenditures of retainer payments for day programs. But I was told this morning by Tom that OPWDD is not seeking that because it's retroactive to January. We're not going to get any additional retainer payments, but we need to focus on reopening and all that. And did you guys talk about the guidance that came out yesterday, which I haven't had a chance to read, but I have. We'll get into that after. So one of the things that the CMS guidance says, or I should say 3 of the things, is that in order to qualify, states must not impose stricter eligibility standards, methodologies, or procedures for HCBS programs and services than were in place on April 1st, 2021. So we can't have a reduction of services from what was available on April 1st. Then we have to, states must preserve covered HCBS, including the services themselves and the amount, duration, and scope of those services that were in effect on April 1st. So if residential providers were receiving all of their payments for people who were in the hospital or at their family's home for the weekend or for vacancies, that can't be changed from what was in place on April 1st. But it's not that simple. To me, the language is clear, but it's not going to be as easy as we had hoped. And maintain HCBS provider payments at a rate no less than those in place as of April 1st, 2021. So any reduction in rates won't be able to be accomplished for the duration of the expenditure of the whole money. So if we have till March 30th, 2024 to spend that entire $629 million, and if we don't spend it until then no rate reductions can take place between now and March 30th, 2024. This is what the guidance says. What will happen, I don't know. Questions were asked on the CMS call yesterday about situations like OPWDD got CMS approval for the May 1st cuts. but they haven't been imposed yet. And the answer was confusing and like, we'll have to look at that on a case by case. So we don't know what is going to happen. To me, the guidance requires no May 1st cut in order to be eligible for the funds, but we'll see what happens. Does anybody, that's probably as much as I can tell you right now, except that NIDA, so I'm with the Interagency Council of Developmental Disabilities Agencies. There's 6 other associations across New York State that are like ours, and we're all together in the New York Disability Advocates, NIDA. NIDA doesn't advocate for everything in our field together, but we do on some things. And one of the things NIDA is working really hard on right now is to make recommendations on how that $629 million should be spent. And we're obviously recognizing the workforce crisis that everybody is dealing with right now. So that's going to be a big part of it. So we're looking at some sort of a percentage increase that would be more immediate. And I say that because I don't know when the funds are going to actually be available. You know, it's 30 days and then 30 days to review the plan. And then, and is there other money that could be spent while they're waiting to backfill? And then the rest of it would be grants. Ellie?
Yeah, how do you, what is the reasoning behind being able to give workforce raises? I mean, bonuses I can understand, hazard pay, I don't see how you can call them raises.
So I think what I meant was that the guidance doesn't preclude that. And I understand that it's something that a state would have to be committed to going forward with. So it's not so easy to do that with one-time funds. Did that answer it pretty much?
Yeah, that doesn't mean we shouldn't advocate for it, but it's gonna, the other end of it is in doubt, yeah.
And I think that's a really good segue to discussing a little bit the 507 plan again and all of the discussions that are going on with that. So if you take workforce for an example there, and a 507 plan is about where we want to be in 5 years, then what do we want our workforce to be like in 5 years? And then what is going on right now that's going to kill us and won't allow us to get to 5 years from now in the way that we want to? We have to fix immediate issues, but with an eye on that 5-year goal. So if we can kind of really envision what we want for 5 years from now, which of course will be updated every year because that's also part of the 507 process, then we can make good emergency decisions that will get us to where we want to be workforce-wise. One of them certainly is to raise salaries, recognize the incredible work that DSPs do to create career ladders and provide all kinds of, you know, workforce development initiatives, whatever they are. Maybe it's legislative, maybe it's, you know, more like tuition assistance, maybe it's credentialing, maybe it's all of those things. So we should raise salaries right now if we have the money to do it, because that is where we want to end up. And again, it's not our decision. It's not NIDA's decision. It's not one group. So it's something that we all have to think through and figure out so that we can be what we want to look like in 5 years. And just to wrap up the 507 thinking from my perspective, so all these different groups, and I know a lot of you on this Zoom right now are also having conversations, and you know, Ellie and I talked just the other day about, you know, trying to coordinate conversations between groups, and I think the best thing we could do is to share our thinking and try to coalesce in the best ways that we can, because this is really an opportunity for us to all work together in a way that will get us to where we need to go. And I think that while, you know, I heard James say some really specific things, and all of that is absolutely important. We definitely need to start with the giant perspective items and come up with, you know, the framework for us to put that kind of meat on the bones. Any thoughts on that before I move on?
Yeah, I just want to say there are a bunch of groups. So one is called Collective Advocacy, one is called Jamboree, and one is called SOS Save Our Services, which the DD Council is part of. The SOS is the group that put the rally together, and the I don't know the orientation for our new legislators. I keep calling them newbies, but you know, they're not new anymore.
No, they still are.
If
And
you
those
go on my computer and look for that, you need to have the word newbies, not new legislative, you know. Anyway, so share any ideas that you have through Kathy, through the council, and then they'll filter up and we'll keep sharing everyone else's. So the Jamboree met yesterday, and the Collective Advocacy is going to meet today, as is SOS. So by tomorrow, we'll be able to kind of give you a recap as to where those three groups of geniuses are.
And also IAC has a legislative committee of the board, and that will be the thing that we discuss this afternoon at 4 o'clock for those of you who are on this call. And
so I'm not promising anything because I don't take minutes very well, but we will have something. Some, you know, semblance of mushing it all together.
Yeah.
So Winnie, it's Margaret. Has there been any thought to other ways to reward direct support staff other than a salary increase, which is risky, you know, at the end, such as payments for longevity? You could have, you know, 1 year, 3 years, whatever, that we wouldn't lose anything major, you know, if we didn't get an extension of it.
so what NIDA is proposing, and again, it's being, you know, discussed. So this is not final, but they're talking about a percentage increase on rates that would be used in a flexible way by providers. So if I wanted to give longevity bonuses at my agency, I could do that. So we're not going to advocate that there be strict rules for that. Providers can do whatever they would like, and that's probably one of the things they'll do quick.
Yeah. Okay, thank you.
All right, good. And we can talk more about that as the conversation continues. And another thing about staffing, so one of the things that NIDA is doing right now is asking providers to send back a survey on their vacancy and turnover by May 21st. So that is really short turnaround, although I guess it was sent out maybe last week. But we need the information right away and to figure out what the current situation is so that we can advocate better for using the $629 million in that way and other things. There are two bills that are not going to pass this year. One of them is to create a credit and career ladder for DSPs, and it would be collaborations between providers and local community colleges that would cover tuition. DSPs could go part-time or take a couple of classes here and there, and it would all go toward a credential and then, you know, go toward a degree at the college. And they would be tuition free. There would be a little bit of money to reimburse. You know, I'm not exactly sure of the mechanics, but it will cost providers something. It will probably cost the community college something, and then there'll be a little bit of money also put in by the state. But it's been something that the Alliance of Long Island Agencies has done on Long Island for many, many years, and lots of people got degrees, and it's really a good thing. And then there's another thing, which is this kind of a big credentialing collaboration that is pretty elaborate. And that's another thing that we want to try to get done administratively. We don't need these two bills to get it to happen, and we can use some of that $629 million toward those two things. So again, if we decide what our workforce should look like, then we can make all of the right decisions in spending this little bit of money that we have right now to get to where we need to be. So let me just see if there was something else on that list before I get into. Also with regard to workforce, there's going to be a summit on June 2nd. NIDA is holding that. It's going to be 10 a.m. to 1 p.m. We'll send out the link to everybody so that it'll be, you know, you can view it. And then there'll be certain participants, probably by invitation only, and I'm not exactly sure how that's going to work because we're still figuring that whole thing out. And NIDA also has a workforce work group that is, again, figuring out what it is that we would like to recommend that we do to build our workforce. So the other couple things that I wanted to talk to you about was the New York State HERO Act for a minute. I don't have much to say about the new guidance that OPWDD just came out with, but I know that for day programs, as Willow had warned me, it sounds like there really isn't any capacity restrictions that have been removed or changed. So I know everybody knows that the CDC has made some recommendations for fully vaccinated people and that New York State has approved them, but obviously we're waiting for our guidance on how that will apply to our programs. There was a resolution that was passed in both houses of the legislature, and this was to honor essential workers with disabilities. And there were really beautiful, moving speeches on the floor in both houses talking about how the people who we support in jobs got us through the pandemic and risked their lives, and that they are contributing members to their communities and to all of us in ways that we should be recognizing. And we're viewing that as kind of the beginning of elevating the whole our workforce initiatives for people with disabilities. And I'm not sure exactly what we're going to do next, but I think we're planning some sort of a maybe a social media campaign and some other activities. There's a new Assembly task force that is specifically geared toward people with disabilities obtaining employment. So this is a really, really good thing for us. And, you know, we feel like while we've suffered a lot this year, there've been some really good things that have emerged, maybe because of it and maybe anyway, but we're in pretty good shape. There's a couple of other bills I should tell you about. One is, and it looks like this is going to be passing both houses, and we'll see what happens when it gets to the governor's office, but it would provide for Medicaid coverage of ABA. And this is for anyone, regardless of age. There's no restriction, and it would be a wonderful addition. Currently, insurance covers ABA, commercial insurance, but Medicaid, it's not in statute. So this bill will put it in statute that it would be covered, and it's something that we'll let you know if we need any kind of action after it passes the Assembly, which ought to happen tomorrow. The legislature is not in yesterday or today, but they're going back tomorrow, and it's on the Assembly floor, and we expect it to pass. And then the other one is the Covered Lives Bill for Early Intervention. This is a bill that also looks like it's going to pass both houses. It has failed to pass both houses over the last number of years. I think this bill is like 15 years old in the Assembly. So we've gotten farther than we've ever gotten before, and we're hoping that we can get that to happen. That would eliminate all billing and claiming of insurance for early intervention services. And it would be much easier for providers, easier for counties, and there's a lot of momentum behind those bills. Also, it would get insurance companies to pay their fair share of early intervention. They wouldn't be denying claims all the time that we have to appeal. And it's only the beginning, which is probably why it won't be signed by the governor, but they'll put in $40 million this year, and then as expenses go up and their share should go up, they'll have to put in more money as the years progress. Okay, so the New York State HERO Act. This has been signed into law by Governor Cuomo on May 5th. And parts of the bill go into effect 30 days from May 5th, and other parts go into effect 180 days from May 5th. It's about protecting employees from airborne infectious diseases. It's definitely aimed at things like COVID. Again, it's preparing for the next pandemic. Some people are worried that it will include like the flu every year, but I don't think that's the intent, and we'll have to wait for the regulations to come out to see what's really going on there. But it includes every employer and employee and work site, except for state operated anything, or, you know, government operated anything. So school districts don't have to do this, but our schools do. State operated OPWDD services don't have to do this, but our services. It covers all of the things that we've been doing with the COVID-19 pandemic, and it includes employees' protections from retaliation for exercising their rights, reporting violations, reporting exposure concerns, or refusing to work if the employee reasonably believes in good faith that there's an unreasonable risk of exposure. Employees also could bring a civil action against an employer who has violated the plan in a manner that creates a substantial probability that serious physical harm could result. And we'll have to see what the legal community says about all this. There's also going to be workplace safety committees that'll have to be developed, and there'll be 2/3 non-supervisory employees, and the group is empowered to review the adoption of any policy, review reports filed by the employer, schedule regular meetings during work hours, and attend training related to their charge in the group with pay. It's pretty extensive. Does anybody have any questions about that? I mean, aside from the ones that we all have. Okay. So we've also got a Twitter campaign going on right now for our schools. And the great thing that happened for our schools this year is that the State Education Department requested 7% tuition increases for both our 853 school-age schools and our 52 preschools. And we've been doing all kinds of work to try to shore up the possibility of us getting that 7%. So the counties pay a little less than half of the expense for preschools. And in the past, they have not had the money to be able to support a 4% increase for us, which has been really, really awful and put us in a situation where COVID-19 nearly put a lot of schools out of business. And if we don't get relief, it will have done that. So we really need the 7%. This year, the counties are completely on board with getting us the 7%. They're also getting some federal relief. And we're working with them to strategize on how to get the state to pony up their a little more than 50% of the expense of our preschools. So we have a Twitter campaign. It's for both our preschools and school-age programs. And every Tuesday and Thursday, I'll get this information to everybody. I send it out to IAC members, and I haven't done it yet today, but I will because it is Tuesday. And we have a different graphic that supports the 7% increase for our schools. And we encourage everybody to participate. If you just follow me on Twitter, and my Twitter handle will be in information that I'll get to you guys. All you need to do is retweet my tweet and tag your assembly member and senator so that they can see it. So it's really, really simple. You don't have to be really good at Twitter. I am not, but all you have to do is retweet me. So I think that's everything. Did I not cover something that somebody's interested in hearing that I might be able to talk about? Okay.
Did you want to plug IAC's conference?
Oh, thank you. You know, I felt a little funny about doing that, so I wasn't going to, but now that you've invited me. So IAC is having a conference. It's a 3-day virtual conference. The title is Opportunities from Crisis, Designing a New Future. That's where we're all at, obviously. The dates are June 22nd, 23rd, and 24th. The 23rd is going to be just education. So if you're an education provider and you don't care about OPWDD services, there's a reduced rate, and I don't know what it is off the top of my head, for that one day, which is the 23rd. But all the days will be interesting and full of good information. June 22nd and 24th will be OPWDD services. And we've got a keynote speaker. Her name is Maysoon Zaid. She's going to talk about survival of the unfitted. She's an actress and a comedian, and I hear she's really great, although I haven't seen her myself, but I know people love her. We have a leadership beyond the pandemic, embracing technologies that will enable amazing possibilities, succession planning, and then special education, fiscal survival strategies. We're going to hear from SED top officials, and we're having somebody from the Biden administration come and talk to us about special education policies for the new Congress. And the last day will be Commissioner Kastner kicking us off, Mary Sowers from NASDS, who will talk about OPWDD thing and CMS stuff from the national perspective. We have from the ARC of the United States, Nicole Jorwick. Her work lately surrounds eliminating the waiting list, which is something that we would all love to do. And then we have Kate Marley, who will talk about Medicaid and where we are now and where we're going and where we've been. So that's the conference, and we'd love to see you there. You can go to the IAC website to register, and that's iacny.org. Thank you very much, Kathy.
Thanks, Winnie.
Kathy, it's Margaret. Before we go to the committees.
Okay, we'll
could I
move
just-
on to committee. Yeah, go ahead, Mark.
Yeah, before we move on to committees, I'd just like to mention that OPW website has new data on the coronavirus infections. It's on the coronavirus page. You just scroll down to the bottom, and it gives you the infection incidence by a provider agency, and it gives you information about staph infections and fatalities that haven't been provided previously. Staph fatalities are really relatively low, thank God, 37 total for the state. That's cumulative versus, I forget what it's up to now, but it's like 600 or something. Over 600 for people with developmental disabilities. But it's got very interesting material on it. You might want to check it out. Thank you.
Great, thanks, Mark. Moving on to committees, Carol, for the Family and Provider Information Committee.
Hi, everybody. Yeah, my committee's been a little bit quiet, I admit. I'm going to get myself revved up over the summer and start getting some amazing ideas. Would love some feedback about topics. There's so much going on and so many webinars and so many things that it's been hard to compete with that level of interest, but let me know your thoughts. Thank you.
Great. Mary for Manhattan Family Support Services Advisory Council.
Hi, everyone. No, Jackie and I really have nothing to report. It's been quiet after a busy March and April, but we'll send out a MailChimp soon. Thanks.
Great, thank you. Andrew or David, transition.
Everybody. So the transition committee will be holding a meeting on June the 9th at 10 o'clock. We're going to have some guests coming to speak about sort of person-centered planning strategies that they use around transition. We're going to have representation both from the school perspective and from the adult service provider perspective. So we hope that it's going to be like a really kind of a fun conversation. We've had so many hard conversations over the past year about COVID and safety and that kind of stuff. So I think that this will be a really nice, and I think there'll be some really tangible tools that both hopefully we'll be sharing that anybody that attends can take away that they can try out. So we encourage you to attend.
Great. Thank you. And thank you for David and Andrew, and as well as Mary and Jackie on doing a really nice job during the month of April as transition month. And a number of agencies had the opportunity to kind of participate and highlight some of their service options to kind of facilitate the transition process for this year's grads. So thank you for all those involved with that.
Oh, Ellie, I want to say one thing. I want to, in terms of transition, I want to thank David and Mary and Andrew, actually, and anybody else who was involved. New York City Fair was able to put together a transition Zoom thing, transitioning from school to adult services, and they were enormously helpful and actually participated on camera. So you can go and look at the video of the event on YouTube, NYC Fair's YouTube or our website. But they were spectacular, and thank you for your generosity of time and energy and thought.
Oh, and real quick, we're also nearing an update of the Manhattan Adult Day Services Directory. You should have heard from us already, but if you haven't, I'm going to put my email in the chat, and you could just shoot me a quick email. I'll send you a survey to fill out. That's going to include information on day half programs, supported employment, other employment services, and any other services that are specific to transition age youth and adults who need OPWDD supports.
Excellent. Thanks again. Jim, update on legislative?
Because Winnie had done such a good job on reporting all of those items in greater detail than I would have, I'm just going to continue the silence. So yeah. Thank you, Winnie.
Great. Thank you. Just a couple of updates. Manhattan DD Council, along with the other borough DD councils, have extended an invitation to OPWDD to do a presentation to the joint councils on the CAS assessment. Generally, we understand, and particularly as James reported earlier, OPWDD is moving towards acuity-based funding of residential reimbursement, including the CAS assessment. And so we've asked OPWDD to do a presentation just to go over the process of the CAS assessment, how it's done, who's involved, and then once it's completed, how that information is intended to be used. So we'll keep you updated. We do not have a date yet or a commitment, but it is something that we are working towards. So we'll keep you updated on that. Also, we did do, along with the Family and Provider Information Committee, we did do some exploratory talks and discussions about a family support fair. And, going to have one this year. However, we are hoping to get an in-person one either at late fall or spring of next year. As we continue to move forward in reopening, I am quite optimistic that by next year we will be back to at least having some live meetings and hopefully a live family support fair. So more to come on that as we move forward. And then finally, our next meeting, which will be the last meeting for this go round of the year at this point, will be Tuesday, June 15th at 10 a.m. We do use the same link each month. So, I will send out a reminder probably along with the minutes shortly, a few days before. But just in case you don't get that or miss it, it is the same link that you used today. So any final questions, comments, concerns? No. Then have a great rest of the day, and we shall talk with you soon.
Thank you. Bye.
Thanks, Kat. Bye.
Yeah.
Thank you. Have a great day.
Thank you. Bye, everybody.
Thank you.